Hi, everybody. I wanted to take a couple minutes and just talk briefly about the personal care home administrator exam that you are preparing for. We often get a lot of questions about the exam, the structure, what's required, what's the exam like, how much time do we have, what type of questions there are. So I wanted to just spend a little bit of time to kind of talk about, give you an overview about the exam, how it's structured, and just some things to think about regarding the personal care home exam. So the exam is a 2-hour, 100-question, multiple choice exam. The majority of students are done within about an hour to an hour and a half. Whether you're taking the exam in person or if you're taking the exam online, you really shouldn't feel rushed. You should be able to take your time and not feel any pressure to, that you're falling behind. The exam is structured very much like the training in that the content, it mirrors the content of the training. So, for example, the first page that you'll see in the exam after you register might be questions, maybe 8 questions on fire safety. The next page may be 4 questions on CPR and obstructed airway. Then the next page might be several questions on personal care. And it'll go on throughout the different topics that you've taken. So it doesn't hop around. The questions, again, are follow the sequence, if you will, of the actual training that you've done. One of the recommendations we have is to, just like any standardized exam, is to take your time to read each question carefully, to look for the exception words. Sometimes you might have something that says all of the following is true except. And the same goes true with the answers. Some of the answers are very close to one another. So you want to make sure you take your time and you read the questions, each of the questions carefully. Some of the questions, since they're so close to one another, they might be the same first sentence, but then the second section, the second question or the second answer, the second part of the answer might have a clause in it that changes the dynamic of the answer. So you really need to read all of the question carefully as well as the answers. And one of the bits of advice we like to give students is, even if you're really cruising along doing well, don't get compliant, don't get, almost overconfident and start getting lazy and not reading carefully, because, they might still throw you some questions that you really need to pay attention to. So those are the things you really want to think about. Again, and this is true whether you're taking it in person or if you're taking it online. When you do take it online, if that's what you choose to do, what happens is a Penn State proctor, exam administrator like myself, we're on Zoom with you and we are sharing our screen. So throughout the exam, we are acting as your hands. We really are navigating the page, and you're telling us, you're reading the answers, you're reading the questions, and you're telling us which answer you would like to choose. And then we go on throughout the remainder of the page and the remainder of the exam. So we really are navigating for you. When you complete the exam, you will be given either success, or it'll ask you to take the exam again. The minimum score is 80, so you need to score 80 questions out of 100 as a passing grade. If you do pass, you can get your certificate right away. What we do is we print it out, or if you're doing it electronically, if you're proctoring online with us, we download it, and then we would email it to you. And then you would have a copy of the certificate from the Department of Public Welfare, your name, the date that you did the exam, as well as your certification number. The last thing I want to say is a little bit about the anxiety that we've observed people have about the exam. Whenever I look at anxiety, I always try to approach it in the following way. It's okay to have test anxiety. I like to equate anxiety as a spidey sense. It's your way of really tuning in to what you need to do. So it's okay to have test anxiety. Where it becomes a problem is if it it overtakes you and you do become lackadaisical in reading the questions or reading the answers, or you don't spend time studying, or you kind of panic and you don't know where to start. What I recommend people do when they are preparing for the exam is to view it systemically, just like any other exam you might have taken in your life. Don't cram for it the night before, like some of us did in college. What you want to do is you want to start early, and you have your compliance guide. Start with a topic that you're confident in. Maybe it's medications. And you study and you look at the rules and regulations, and then your notes from the class about medication administration and procedures. Read that carefully. Make that maybe day one. Day two, look at fire safety and look at your notes from the class. If you have any other information from work about your specific fire safety requirements, review them too. But the compliance guide will be a big, big help as you're preparing for the exam. Again, it's laid out just like our training is, and just like the exam will be. And a lot of those questions, that content will be in question form on the exam. The last thing I would say to people is there is currently, through the Department of Public Welfare, a direct care staff certificate. It's free. It's a self-study program. I think it's about 8 hours. And that content and that exam, which is free to take, is very similar to the content, some of the content that you would see as a personal care home administrator. So what we also recommend individuals do is to maybe register and then take that exam as kind of a pretest. First off, content-wise, it'll help clarify what some of the content might be. It also will get you in the frame of mind that you need to be to take the exam. And it'll give you some of that test prep, as well as it would very well might reduce some of your test anxiety, which is all important. The last thing I'll say is if you are in healthcare and if you have sat through the Penn State training, you know this content. This information should not be any surprise to you. This content, these questions, they are not out to trick you or to throw you for a loop. They're not going to ask something that you haven't learned and you haven't studied. I can't say enough about our instructors as well as our students at Penn State that have been through this program. We have a 100% pass rate. And again, the reason that we have that is we have very diligent students that have studied hard, have worked very hard, you being one of them. And we have good instructors, we have good materials, we have good advice. And I think you can be confident when you do eventually prepare and sit for that exam that you will do well. And again, I want to re-emphasize, it's okay to be anxious. It's okay to be worried. That is just your spidey sense. That is just your body's way of saying, you know what? I can't do this right now. I really need to focus on the personal care home administrator exam that I'm taking very soon. And so with that, you will do wonderful. If you have any questions, feel free to reach out to us. We have a lot of advice. We have a lot of guidance. and we'll be happy to work with you. And we're really looking forward to the day that we can celebrate with you when you do pass the exam, whether it be in person or it's online. It's a wonderful thing. It's a wonderful experience. It's one of the reasons we love what we do here at Penn State, to celebrate with you. So with that, take care, prepare, and we will be talking with you soon. Bye now.